Hi, my name is Dr. Dourron from Pathways Fertility in Atlanta, Georgia. I wanted to talk a little bit about PCOS, or polycystic ovarian syndrome. It's a very common condition. I see it in as many as 30% of my patients. And it basically consists of patients that are not ovulating efficiently. They often have a predisposition to diabetes, or they're considered pre-diabetic. They often have insulin resistance, and they may have hyperandrogen or an increased level of male hormones. What this means for the patient is that she may have a period once every 2 months, once every 6 months, once a year. And we know that if they're not having periods, they're not ovulating. And if they're not ovulating and they want to get pregnant, they're not going to have a good opportunity to conceive naturally. The important thing is that medications have existed for many years, starting in the early 1960s with medications like Clomid, and more recently with letrozole or other specific medications that help patients with estrogen receptors. And what we're able to do is we're able to help these patients grow eggs naturally without overstimulating the ovaries. The scary thing is that when patients have PCOS and you give them injectable fertility drugs, often it's like flipping a switch. You go from no eggs to forming 20 eggs. And that's dangerous, and that's how they can have multiple pregnancies and so forth just by having intercourse or insemination. So the important concept is that PCOS is something that can be treated effectively with oral fertility medications, and generally about 70% of patients that have PCOS will be successful within 3 months of treatment.